For most people, anemia is just a condition where hemoglobin is low and it can be increased by taking iron. But if you think this video is about anemia, its causes, the diets which increase hemoglobin, then wait, this is not that. In this video, we'll discuss many different aspects of anemia based on what I see in day-to-day practice and patient interactions. So hello friends, I am Dr. Piyush Chaudhari, and in this video, I am going to tell you the different practical aspects and misconceptions related to anemia which will change the way we look at this problem beyond that hemoglobin value on your blood reports. Talking of anemia, very often we see people who are carrying hemoglobins of 9, 10 for years together without facing any major problems. So in fact, it is not very uncommon for me to see patients coming with their health checkup reports where on pointing out that HB is 9 or 10, they just say, yeah, that's fine doc. My hemoglobin has always been in this range for the last several years. So essentially, yes, it is true that they may not be looking very sick or they may not be having many acute symptoms. But what lies behind these values is many subtle clinical symptoms which can be present for a long time. So over a period of time, body gets adapted to these low hemoglobin levels. Now this hemoglobin, which basically does the function of carrying and delivering oxygen to our various organs and cell levels, if it is low, then naturally many of our organs are deprived of oxygen supply to certain extent. So heart has to pump faster and harder to supply the same amount of blood. Brain gets relatively lesser oxygen supply, leading to chronic fatigue, lack of focus, lack of attention, and at times mental fogging. The person may have increased irritability, unexplained fatigue, which we tend to trivialize it, saying that it is because of stress or it is because of lack of sleep and so on. The person may get excessive hair fall and feeling low most of the times, in spite of doing day-to-day clinical day-to-day work normally. But then we have to understand that if this anemia is corrected, then all these small symptoms of anemia can be taken care of, and we don't have to live with those symptoms considering them to be normal. So when we talk of correcting anemia, is it only because of low iron? Well, by and large, the commonest reason for anemia in our country remains iron deficiency, but there are other deficiencies like B12, folate, which can also impact formation of hemoglobin in our body, which requires all these nutrients. Now, at times, the patients may have deficiency of more than one of these elements. So, whenever we are treating anemia, in addition to correcting iron, B12 and folate should also be corrected. Similarly, there are some common mistakes which happen while taking treatment for anemia due to any of these deficiencies. The first and most common mistake which I observe is that the person stops supplements as soon as the hemoglobin rises. So here what we need to understand is that hemoglobin is the first parameter to increase when we start the patient on iron supplements, either IV or oral. But there is something called as iron stores in our body, and this store is reflected by the ferritin value in our blood tests. So while correcting iron deficiency, if it is stopped prematurely just by looking at a hemoglobin number improving, the underlying iron stores may not be replenished, and within next few months or weeks also at times, the hemoglobin may start dropping down again. Second mistake is that people take only iron but not B12 and folate. Third mistake, many times these people have multiple deficiencies. They can have vitamin D, calcium, protein, other deficiencies also nutritionally. So if you are on iron and calcium both, then we have to make sure that both these supplements are spaced apart, but at least 2 to 4 hours. Otherwise, if they are taken together, it can impact iron absorption negatively, and the results may not be as good as we would have liked it. Now next thing is IV iron better or oral iron is also okay? Well, for someone who has milder iron deficiencies, oral iron most of the time is sufficient. The main problem with oral iron, which is actually quite cheap cost wise and doesn't require hospital visits frequently to take injections, but the problem is that more than 30 to 35% of patients have significant GI symptoms with oral iron. So they may get acidity, gases, bloating sensation in their abdomen, constipation, these kind of symptoms, and are unable to tolerate oral iron for sufficiently long durations to correct their underlying iron stores and not just hemoglobin. On the other side, with the IV iron, if someone has significant iron deficiency and moderate to severe anemia, IV iron can bring up the hemoglobin faster compared to oral iron because it is directly given in blood. But the problem is that it is injectable, so you have to take it under supervision in hospital because some people may have severe allergies to IV iron. Secondly, the cost is obviously much higher compared to oral iron preparation. But with the newer formulations of iron which are available in IV form, the relative side effects or allergic risks are much lesser. So now coming to situations where you might have taken a lot of iron tablets, B12, folate, everything, but the hemoglobin is just not increasing. So what is the scene over there? So when it comes to hemoglobin, you would see in your blood report that there are many values between that hemoglobin, white cell and platelet values in that complete hemogram or CBC report. So some of these values are related to the red cell indices which tell us what kind of anemia this is likely to be. So in the kind of anemia with smaller red cells and paler red cells, which typically occurs in iron deficiency also, there are other causes like thalassemia trait, which is an inherited genetic condition where the person has problem about hemoglobin formation at a genetic level. So because of this, in spite of not having any deficiencies or correcting the deficiencies, the hemoglobin may always remain around 9 and 10 in these people without any significant clinical illnesses. Now where this becomes important is that if two persons who are both carriers of thalassemia trait happen to marry or plan pregnancy, then there is a very high chance that their child may have thalassemia major, which is a serious hematological disease. So this becomes very important in such patients as a point regarding which there should be genetic counseling and proper care to be taken to prevent future complications. Similarly, when someone is not having desired results with oral iron or B12, one important issue could be malabsorption. Now, as far as B12 is considered, where there are bigger red cells in the anemia based on those parameters. So here the main two issues are pernicious anemia and malabsorption syndrome. So in pernicious anemia, the factor in our GI tract which is required for proper absorption of B12 from food or from supplements is impaired, and because of that, in spite of adequate oral intake, B12 levels can remain low, and as a result anemia may not improve even with oral treatment. So there IV therapy is a must. On the other side, if we talk of malabsorption syndrome, then this is a condition where there is inadequate absorption of various nutrients, not just B12 and iron, but vitamin D, calcium, proteins, fats in our intestines, leading to chronic weight loss, malnourishment, loss of muscle mass, sticky, greasy, fatty stools, along with anemia. So there again, detailed evaluation for cause of malabsorption and then addressing that cause to reverse the malabsorption condition could result in improvement of the person's health. So far we have been discussing about various deficiencies which can cause anemia. But what is there in that value beyond deficiencies? Well, anemia can sometimes may not be the disease itself, but it could be a subtle clue that these reports are giving us and telling us that there is something wrong at the systemic level. Meaning, if we see some patients, like say a chronic kidney disease patient, because there is a hormone called erythropoietin which is to be produced by the kidneys and which helps in iron being transferred for hemoglobin synthesis, if this hormone is lacking like it is in the CKD patient because of renal dysfunction, kidney dysfunction, then the person may develop anemia, what we call as anemia of chronic kidney disease. Similarly, in people who have autoimmune diseases, like say autoimmune arthritis like rheumatoid arthritis, SLE or other such diseases, then that autoimmune phenomenon can affect our own red cells, sometimes platelets and white cells also, leading to drop in hemoglobin, leading to anemia or low platelet levels. Similarly, people who have any GI problems like say ulcers or at times something as serious as a cancer also, the person may be losing blood in stools slowly and steadily, and over a long period of time they may develop anemia, which is not because of deficiency per se, but it is because of excessive blood loss, which can be picked up by routine stool examinations and occult blood testing. So here we can see that I've seen patients where patient has come with exertional breathlessness and almost was on the verge of going to a cardiologist to get angiography done to see if he has any blockages in the heart, and his routine blood work showed that his HB was 5 because of severe B12 deficiency. Or I've had patients where a young girl was just casually brought by her parents from her college because she was having repeated fatigue and fainting episodes. And detailed evaluation of her blood counts and bone marrow, everything ultimately led to an unfortunate diagnosis of leukemia, which is a type of blood cancer. So really, depending on clinical situation and depending upon which type of doctor you're consulting or for what problem, anemia may mean different things for different people. Now, for me, as an infectious disease specialist, if I have to talk of anemia and infections, then there are of course infections like malaria, which by themselves can cause anemia because of breakdown of hemoglobin or red cells in the enlarged spleen, or because of direct effect of the parasites. Then there can be certain other infections like mycoplasma causing pneumonia, which actually cause immune problems which can lead to anemia. At the same time, many chronic infections like TB, which go on for longer durations, the body and body's immune system traps iron away from the transporters so that it cannot be utilized for blood formation, leading to what we call as anemia of chronic infections, where iron stores in body are normal or in fact supranormal, but they are unable to contribute iron for blood formation, leading to anemia. So there again, understanding what is the root cause and treating it is way more helpful and important than just giving iron supplements and B12. So friends, if we see, anemia is one of the very common problem in our country, especially in female patients. So through this video, I'm sure you would have understood that there are many aspects of this common problem of anemia, ranging from simple deficiencies which are absolutely correctable if treated properly, to some underlying systemic diseases in which anemia just acts as a clue or a signal which our body is giving us to tell us that, come on, wake up, find out what is wrong with you. So if we approach anemia properly and get evaluated correctly, then we can address most of the common reasons which cause anemia and improve our health overall. So if you find this video useful, please share it with as many friends and relatives as possible, and do subscribe to the YouTube channel of FeverCare Center for Infectious Diseases for more such informative videos. And one interesting question in this video, please write in comments which aspect related to anemia, beyond the hemoglobin values of course, which you found most fascinating, interesting or useful after today's discussion. And always remember, stay informed to stay healthy.